my mind, while all the digital technologies enabling long-distance care or in-home health management are critical and no doubt exciting, I still feel like we are all missing the point. Let me share a story. When my oldest son was about 6 months old, he caught a cold. As a new mom, I wasn't sure what to do, so I took him to the doctor. They examined him, told me he had a cold, and I should take him home, monitor his temperature, and otherwise it would be fine. Then, a few months later, he had a rash. So I took him to the doctor, and they told me it was probably nothing, to put some Vaseline on it, take him home, and he'd probably be fine. I went through this routine enough times in the first year or two of his life that I ultimately got the message that it was probably nothing and he was probably going to be fine. Then we went on our first major family vacation, and he was awful. Moody, difficult, not sleeping well. But I figured it was probably nothing, and he was probably fine, just not used to being in a new place. When we got back, I took him for his 2-year checkup, which happened to be the next day. And as his doctor was checking his eyes and nose and ears, she paused and looked again. And then she sat back and said to my son, "Mac, does your ear hurt?" And he said, "Yes." And it turned out he had a grade 3 ear infection. So of course, I felt like the worst mother in the entire world. But the reality is, I'm not the worst mother in the world. I'm just the worst doctor in the world. And you know why? Because I'm not a doctor. But I am the person who makes the first decision in the patient journey for every single person in my household. And my ability to make a good first decision is limited. And that first decision, whether to go to the doctor or the ER, when to go and if to go, is in almost every case the primary determinant not only of the cost of the patient journey, but also the outcome. What I'm getting at is that we have a much bigger gap to address than just the gap between health and care. The bigger gap and the bigger mandate for the digital evolution of healthcare is solving the information gap. The most important mandate for the digital infrastructure we are building today is to bring not just data and information about patients back to their providers to enable care, but to start thinking about how we aggregate and deliver data and insight about a patient back to the patient so that they can make decisions themselves. How do we turn those first decisions and those daily decisions, all of which are owned by the patient, into the best possible decisions? Decisions that yield cost-effective, high-quality outcomes. As we look ahead, we believe it is possible to co-manage health and co-manage risk with our members. And that is informing how and where we invest in digital infrastructure and what we believe to be the next horizon of a digital patient journey.